Welcome to the Australian Chiropractors Association podcast. The ACA is the peak body representing chiropractors in Australia. These podcasts explore the science, art, philosophy, and politics of chiropractic, as well as reviewing the latest research and discussing how chiropractors can strive for excellence in practice.
Welcome back to the Australian Chiropractic Association National Podcast. I'm your podcast host, Dr Kim Lie Jom. I'd like to begin our podcast today by respectfully acknowledging the traditional custodians of the land on which we record this podcast and pay our respects to the elders past and present. We recognise and honour their ongoing connection to land, waters and culture and community. We extend that respect to all Aboriginal, Torres Strait Islander people listening in today. Today we're really diving into a topic that sits right at the intersection of musculoskeletal health and healthy aging. We're talking about two conditions that don't probably get nearly enough attention, that being sarcopenia and osteosarcopenia. Together they represent some of the most significant yet under-recognised contributors to frailty, falls, fractures and loss of independence in the older population. To help us unpack the similarities, the differences, and what clinicians and communities need to know, I'm joined by Dr Peter McGlynn. Dr McGlynn is a registered chiropractor currently practicing in Melbourne. He holds a Master's in Public Health and a PhD in Global Health Nutrition, Public Health Nutrition. He is certified by the International Board of Lifestyle Medicine and is a Fellow of the Australasian Society of Lifestyle Medicine. He is a fellow and the current chair of the Australasian Institute of Chiropractic Education and Lifestyle Medicine Clinical Practice Group and a board member of the Australian Chiropractors Education and Research Fund. Dr McGlynn will bring very deep expertise into aging and physiology and musculoskeletal research. We'll explore how these conditions develop, how they're diagnosed, what their management is unique, and importantly, what we can do to support the healthy aging process and the communities in Australia at large. So without further ado, let's get into it. Firstly, welcome to the podcast, Dr. Peter.
Thank you. It's great to be here.
That's fantastic. And I really appreciate your time. I had the pleasure of meeting you and watching you speak and hearing you speak at the last WFC in Australia. And it was very insightful. And I thought, we've got to have Peter in on the podcast sooner or later. And so I do appreciate your time. I know you're a busy man. I've got a ton of questions, and some of these questions I think the listenership will really enjoy, because I myself have come across this a number of times, but I think that there are populations that are looked after and cared for by our chiropractic community who would really resonate with some of this information that we're going to dive into today. So to start us off, Peter, can you explain basically explain what sarcopenia is for those who are not too familiar with it, and how does osteosarcopenia differ from the sarcopenia itself in terms of its definition and clinical presentation?
Yes, well, this is something I've come to late in my career. This wasn't a subject of discussion or education when I graduated from RMIT many years ago. But sarcopenia is a skeletal muscle condition. It's characterized by three parameters: low muscle mass, low muscle strength, and poor combined physical performance. Mm-hmm. So it's been recognized as a specific disease by the International Classification of Disease Code only as recently as 2016. So the healthy aging and the intersection with musculoskeletal health and sarcopenia is a very recent addition to our toolbox and the things that chiropractors and other health providers are exploring. Mm-hmm. And in terms of sarcopenia, there's two main manifestations. Primary sarcopenia, which is what we're talking about today, is associated with aging, usually defined as over 60 years old, whereas secondary sarcopenia, or loss of muscle mass and strength, can also occur at any age and can be secondary to malnutrition or post-fractures or post-hospitalizations when physical activity and poor nutrition leads to multiple chronic diseases. But here we're talking about the age-related or primary sarcopenia.
Yeah, right.
So osteosarcopenia, in contrast to sarcopenia, is the addition of osteopenia slash osteoporosis plus sarcopenia, and so is defined by low bone density in addition to low muscle mass and strength and functional capacity. And that's something that we as chiropractors see a lot in our practice, and probably it goes unrecognized and undermanaged for chiropractors, but not only chiropractors, other health providers, GPs, a whole range of health providers probably don't pay attention to this emerging geriatric giant as we could.
Yeah. So obviously the ramifications would be quite serious if we don't start paying attention to it.
Exactly. Because when people have low muscle mass and muscle strength associated with aging, in combination with low bone density, it's really clear that both are associated with increased frailty, falls, fractures, hospitalizations, and of course premature death as well.
Yeah, it's interesting, isn't it? How, and also we all can recognize and acknowledge the fact that we are an aging population. So this couldn't have come at a better time to have a greater understanding, particularly amongst us chiropractors, right?
Exactly.
Yeah. Before we dive into a little bit more the physical and the technical side of the clinical details, correct me if I'm wrong, I understand that you and your team, the ACE team, have received a primary health network, or as they known as PHN, grant to conduct a proof of concept study on sarcopenia from the federal government and their Department on Health and Disability. Is that so? Can you tell me more about that?
Yes, well, this is another thing that I've come to late in my career. I've never been involved in primary health networks, or my real focus has been within the chiropractic profession, and by extension of that, with providers that refer patients to me, and I refer patients to them, like GPs and exercise physiologists and nutritionists and dietitians, etc.
Yeah.
But I've never really got involved in the broader health network outside of chiropractic and the immediate referrers. But the primary health network in Australia is, a compilation of a whole range of health providers, and it's funded by the national government, the Health and Healthy Aging, Department of Health and Healthy Aging, and we were fortunate enough to recently get a grant to provide this proof of concept study for screening sarcopenia and the management of sarcopenia in the Healthy North Coast PHN on the border of New South Wales and Queensland in the Tweed area.
Yeah.
So we're at the moment recruiting for that, and we're just about to roll out our management strategy and then reassessment in February, and we'll have a report out to the government and to, of course, the chiropractic profession by the end of this year.
Wow, that's fantastic. That would be one of the very first times I'd imagine a chiropractic initiative has been supported and funded through a government agency. Would that be correct?
It certainly seems so. And the people that we applied to on the Healthy North Coast in the Tweed area for this funding, they were very surprised that we as chiropractors were putting our hand up, because I think it's something that we don't traditionally, or we haven't traditionally done. And certainly in my career, I haven't reached out to the PHN network previously either. But I think it's a real opportunity for chiropractors to show other health providers how well educated we are, what a great product we have in terms of healthcare, and to really increase our visibility within the broader healthcare professions.
That's fantastic. So certainly my hat's off to yourself, Peter McGlynn, and Carl Fisselwaite for all the work you've done in that. So good luck with the project anyhow, and we can't wait to hear the results later in the year, like you said.
Thank you.
So it's an absolute pleasure, and well done. Congratulations more than anything else. How do you see the importance then of assessment as management of sarcopenia and osteosarcopenia, aligning with our chiropractic scope of practice and the engagement, and then in turn the engagement of the wider healthcare community?
Well, as we all know, as chiropractors, we've traditionally focused on the hands-on assessment and management of neuromusculoskeletal conditions and the ramifications of that. But by identifying our patients' lifestyle behaviors and the assessment and management of sarcopenia and osteosarcopenia, this provides us with a really good opportunity to broaden the conversation beyond just the hands-on musculoskeletal conditions that we traditionally see in chiropractic practice. and the benefits of chiropractic care for wider health promotion and metabolic consequences and prevention of chronic diseases, etc. So it broadens our scope of practice. Well, it kind of leads our scope of practice to where we really should be as chiropractors, not only looking at back pain, neck pain, headaches, and neurological conditions, but how that impacts on overall health and longevity and quality of life. And that, to me, is right where chiropractic should sit, not just within spine-related conditions, but the effects of that plus lifestyle on general health and longevity.
No, I think that's so important. I think it seems as though the natural progression of our profession has started to incorporate all those aspects that you're talking about, and I think we need to take that in consideration. And those who are not inclined to do so may work with other practitioners in terms of as a team and as a unit for the betterment of the patient, right?
Exactly. And it's not for chiropractors to necessarily manage chronic conditions. That's not really our scope of practice.
Correct.
But I think certainly fair and square in the middle of our scope of practice is to at least assess the lifestyle behaviors that our clients present with, how that may be affecting their health, not only their neuromusculoskeletal health, but their general health and prevention of chronic diseases. And then once we identify that and which lifestyle behaviors may be appropriate for modification, then we refer out to the appropriate health providers that are best placed to kind of implement that management strategy.
Yeah.
And that could be, the quit line for alcohol and tobacco. It could be a dietitian for improvement in nutritional management, sleep clinics, mental health clinics, all those things that are not firmly within the chiropractic scope of practice.
Exactly. Yeah. No. Fantastic. And that also broadens our scope in terms of being held in terms of the other healthcare practitioners in society as well. Which is great. It's great advancement for the profession itself. In terms of sarcopenia, you mentioned earlier, obviously relating to mainly affects muscles and its function, and osteosarcopenia involves both muscle and bone loss. How do these two sort of conditions differ as people age?
Because this is a really key question, especially in light of the fact that currently, there are estimated to be approximately 841 million people aged over 60 in the world, but by 2050, that's estimated to almost triple to 2 billion people. So it's a really growing market and a growing need within our community. And regarding sarcopenia and osteosarcopenia, there's a real great variability in clinical presentation, as muscle loss and bone loss can occur at different ages and for different reasons. They can either occur independently, and yet they have similar risk factors. So women and men develop conditions differently due to hormonal differences, and their progression is clearly related to the client's health and lifestyle factors, which is what we are advocating to assess. As we probably know, as people age, the aging population is now moving less and eating more, leading to low bone and muscle mass and increasing body fat, which has ramifications not only for us and the chiropractic clinical conditions that we're treating, but for their general health. So this will inevitably move towards greater risk of number of falls and fractures and hospitalizations, and avoidable premature deaths as well.
Oof. That's concerning.
It is concerning, but it's a great opportunity for us.
Oh, yeah, absolutely. So fantastic. The prevalence, though, varies quite a lot for both conditions. What are the major differences in terms of prevalence for the two conditions across the older adults?
So they can occur independently or together. So sarcopenia or muscle loss can occur independently of bone loss and vice versa. But as a general rule, they generally tend to occur together as we age. So primary age-related sarcopenia is estimated to be up to 29 or 30% of community-dwelling older adults. That's people generally living in the community. And it's much higher than that in those that are hospitalized or have multimorbidities or are living in residential aged care. So as a general figure, approximately 30% of people we see over 60 will have either one or the other of muscle loss and bone loss with metabolic consequences and risks for their future health. So it's even greater in people which have multimorbidities, such as diabetes, or cardiovascular disease, or gut-related cancers, where they may be eating less and finding it difficult to digest, and that could prevent them also from doing the physical activity that they need to maintain muscle mass.
One of the things that I think I keep hearing you saying is the nature of lifestyle. Those factors seem to be a large contributing factor. So when it comes to risk factors, like age, inactivity, you've mentioned poor nutrition, hormonal changes, and all those factors, where do both sarcopenia and osteosarcopenia, where do they overlap? And I guess to some degree, where do they diverge?
So when we're talking about sarcopenia and osteosarcopenia, they're very similar risk factors, both including age and sex, also including genetic factors, mechanical loading factors, and hormonal factors all play a part. Genetic factors are usually evident quite early and important in determining peak muscle and bone volume early in life, usually around about 30. So after that, there's, depending on our age and sex, there's a decline in both muscle mass, muscle strength, and bone density. Gravitational loading is really important because that transfers muscle contraction forces to the skeleton, providing mechanical stimuli to maintain bone density. Physical inactivity is the major factor in older people. Especially if they're ill as well, because it results in atrophy of both tissues, muscle and bone, whilst physical loading is hypertrophic to muscle and osteogenic to bone. So the more people are exercising, the better their muscle mass is and the better the bone density is. The metabolism of both tissues are similar in that amino acid availability determines the rate of turnover of both muscle and bone. And hormonal factors are, of course, very important too, with men gradually decreasing their muscle mass and their muscle strength and their bone density slowly as they age, whereas women post-menopause, of course, their muscle mass and their bone density falls off a cliff in a much more severe way than it does for men. We end up at the same place, but men deteriorate slowly from 30 onwards, and women deteriorate less until menopause, and then they really deteriorate quickly in both bone density and muscle mass after that.
Yeah, well, so you obviously mentioned the differences there. So sarcopenia, as we already discussed, itself increases the risk of falls and functional decline. And you've also mentioned that osteosarcopenia adds, poor bone density into the mix as well. How does the combined syndromes amplify the risk of fractures compared to just sarcopenia on its own alone?
Yeah, so you're correct there. As we mentioned, the risk of both falls and fractures are amplified in sarcopenia compared to those without sarcopenia. So that's the first comparison. Sarcopenic older adults have almost double the odds of falls and fractures than those without sarcopenia.
Wow.
So that's the non-sarcopenic group compared to the sarcopenic group. It's about twice as many falls and hospitalizations and fractures.
Wow.
When we're comparing the sarcopenic group to the osteosarcopenic group, that amplifies it again. So the odds of falls are approximately 3 times greater, and the odds of fractures are 4 times greater for those with both bone and muscle loss compared with just muscle loss. So depending on the complexity of the condition, the risks are amplified between 2, 3, and 4 times.
Yeah, right. So that 4 times is huge.
It's massive.
If we think of the population numbers that you've mentioned earlier, that's hugely significant.
It's very significant, and it's something that's presenting to us on a daily basis, and it's largely going undetected, not only for chiropractors, but for other health providers as well. So it's a great opportunity here to not only help the clients under our care and identify these risk factors and hopefully make their lives healthier in the future, but to also reach out to other health providers and manage these things interprofessionally to progress our profession and to just increase the visibility of chiropractors.
Yeah, absolutely. Well, your PHN, as you go about it this year, will certainly add a great step towards that too. So, looking forward to that. Now, in terms of assessment, obviously we have the tools like Sarc-F for sarcopenia and DEXA for obviously bone density, but no specific tools for osteosarcopenia. Correct me if I'm wrong in that. What are the biggest differences in screening and diagnosing these two conditions then?
So starting with sarcopenia, it's mainly assessing age-related muscle loss. And so for that, there are four main parameters.
Mm-hmm.
First of all, as you mentioned, the Sarc-F questionnaire is a screening questionnaire conducted in people who are at the right age group. So we can give them a 5-question questionnaire. That includes questions on strength, assistance with walking, how easy it is for them to rise from a chair, climb stairs, and the frequency of the falls in the past. So muscle strength is assessed by grip strength or rising from a chair and is an indicator of pre-sarcopenia. So if they've got muscle strength and low muscle mass, so muscle mass is assessed using the DEXA scan, or a lot of health providers have a bioimpedance machine within their practice.
Yeah.
DEXA is a little bit more complicated, but more beneficial for diagnosing body composition.
Mm-hmm.
But an easy way of getting into this in a chiropractic clinic is to have a bioimpedance machine in our clinic and just to assess their muscle mass that way. So that's a DEXA scan or bioimpedance machine.
Yeah.
The severity of the sarcopenia then is assessed using a physical performance battery like gait speed. And if they can't walk at greater than 0.8 meters per second, or we can do a test called the tug test, a timed up and go test, where they rise from a chair, walk around a witch's hat, and then back down to sit at the chair again. Those functional performances of muscle activity really assesses the severity of their sarcopenia.
So all of those tests, just out of curiosity, you would imagine most chiropractors are not only capable, but are probably already doing it anyway without really now putting it down as a possibility that they need to look into the potential of the patient being either osteosarcopenia or sarcopenia, right?
Exactly. And these are simple tests that we could do in the clinic. It just adds a couple of minutes to our initial assessment. And certainly from my point of view, I have never done this in the early part of my career, but of course with the emerging evidence, we're doing a lot more of it now in the clinic. And then you add to that the bone density testing associated with osteosarcopenia, in addition to the grip strength, muscle mass, and functional mobility testing. And then we can come up with a diagnosis of osteosarcopenia as well. And they're neuromusculoskeletal tests that we can do very easily in the clinic. And of course, then we work out a management plan, which we can also implement. And if we need lifestyle modification based on any of the pillars of lifestyle, then we can collaborate interprofessionally with other people who can deal with those lifestyle factors.
Yeah, sure. Now you mentioned in that regard just a minute ago regarding grip strength, gait, all the tug tests and everything, and imaging all play a role obviously in the total overall assessment. How does the evaluation of muscle health differ when you're specifically looking for, I guess, osteosarcopenia versus sarcopenia itself?
Yeah, so that's correct. For both sarcopenia and osteosarcopenia, there's no difference in the evaluation of the muscle health.
Okay.
So we start off with grip strength or sit to stand testing for kind of muscle strength. Muscle mass is assessed by bioimpedance or DEXA, as we mentioned before. And then the functional testing, timed up and go test or the gait speed, that's also the same for both sarcopenia and osteosarcopenia. The main difference here is then doing a DEXA scan, not only for body composition and muscle mass, but including a bone densitometry DEXA scan, which then adds the bone loss to the diagnosis. And so we then can determine whether they're just sarcopenic or whether they are osteosarcopenic.
Yeah, okay. All right, makes sense. So you've mentioned a lot to do with the assessing and then coming up and diagnosing of it. I'd imagine obviously exercise and nutrition are crucial, and you did touch on that in both conditions. Um, but both, but osteosarcopenia, including obviously, I guess what I'm trying to ask is, how does the management, we've talked all assessment, how does the management differ between treating exactly sarcopenia alone and treating osteosarcopenia?
Okay, so first of all, the common factors for both are progressive resistance weight training. So
Uh-huh.
that builds muscle and it also builds bone density. So the primary physical activity management is for progressive weight training.
Hmm.
Regardless of what age, they can do as much as they can do at any age, and can have beneficial well benefits for their
Positive.
muscle and bone density. In
Hmm.
addition to that, there are nutritional considerations. In the case of building muscle, then we need to make sure that they are getting enough protein, because
Uh-huh.
no amount of resistance training will build muscle unless you have the protein to enable that.
Hmm.
And from a bone density point of view, the main thing is adding calcium and making sure they're getting enough calcium to build bone. And in association with that, vitamin D is a real key factor to improve absorption and metabolism of of calcium.
Calcium. Hmm.
So for sarcopenia, it's resistance training plus protein, and for osteosarcopenia, it's resistance training plus protein plus calcium.
Okay, that's fantastic. I'd imagine that's pretty. You probably see that everywhere at the moment. I have noticed in my social feeds that there is a lot of push towards including vitamin D and obviously protein in our diet on a regular basis. And with a lot of the processed foods, we are missing out on these very, vital nutritional supplementation. Even I wouldn't even call it supplementation. It's just essential, really.
Exactly. And we always advocate for a food first policy. The best way
Hmm.
to get protein is to given reasonable digestive function.
Yep.
Best way to get protein is through food. The best way to get calcium is also through food. The best way to get vitamin D is through the sunlight.
Mm.
So they're our go-to preferences. So food first and sunlight first. But where older patients have a less efficient gut system, or they're
Hmm.
not able to get as much protein as they need, then of course protein supplementation and calcium supplementation is a really good way to to
Include
fill
that.
that gap.
Yep.
And so then we can add whey protein smoothie or pea protein if they're vegetarian.
Yep.
Calcium supplementation, of course, it's all really valuable, but in
Hmm.
general, a food first is the preferred method.
Yeah, fantastic. Yeah, exactly. Um, we talked obviously how much sarcopenia impacts the quality of the life of the individual, while osteosarcopenia adds the possibility of fracture risk, hospitalization, and ultimately in the worst case scenario, mortality. From a patient-centered perspective, what are the practical everyday differences in how these conditions affect someone's independence and well-being?
Yeah, so as I mentioned before, the lifestyle determinants of health are very individual,
Hmm.
and where people sit on the spectrum of sarcopenia or osteosarcopenia varies with everybody. So there's not a one size fits all approach,
Hmm.
um, because they have multiple adverse health outcomes and risk factors. But what they have in common is they both include an increased risk of falls, increased risk of fractures, poor quality of life, and premature death.
Mm.
So, as I mentioned before, non-sarcopenic versus sarcopenic, they're twice the risk of falls, fractures, hospitalization, and death. And for the sarcopenics versus the osteosarcopenics, they're three times more likely to fall and four times more likely to fracture. So, as the diagnosis becomes more complex, then the benefits become more important, but the risk factors for falls, fractures, and death become much greater. So prevention is really key here, and early
Mm.
intervention, so that we can get them before they start to fall and before they start to fracture. And that's obviously where we want to be, especially as chiropractors, where health promotion and prevention of outcomes and chronic diseases is really paramount in our paradigm.
Yeah, absolutely. And I think that if you've been in practice long enough, you'll have a core group of people that you've been managing, looking after for so many years that will age with you. And I think it's really important, this information, the assessments that we've talked about, the criteria and the treatment schedules. I think all these things are really important for the average chiropractor who've been working in the area for so long now to start considering and looking at those patients have been with them for 20, 30 years who are now aging. I think what you're saying is the sooner we can assess these, and we could do this quite comfortably because they've been part of the practice for so long that, you know, it's easier to say, hey, listen, I just want to add a little bit more testing this time around now that you've gotten older, and we want to see where you're at, and we can maybe change a few things. And all I can see is that the patient will be, you know, jumping out of their skin to participate, because obviously it's bettering their general health and well-being as they continue to age. So I think it's a wonderful thing that we now need to embark on as a profession, and certainly as the individual chiropractor working, you know, in your little 2x2 room, you know, for the last 30 years. It's worthwhile adding into your protocol now.
That's such a good point, and it's particularly relevant to people who've been in practice a long time.
Yeah.
We all know that evidence for chiropractic is really coming to light about aging and the effectiveness of chiropractic care across the age group. So some people are really comfortable seeing a lot of children in their practice.
Yeah.
We all see adolescents and we all see adults. But once you've been in practice, like I have for many years, it's easy to fall into the trap of actually using the adjustment based on their pattern, their symptom pattern, or their musculoskeletal pattern, and just do the same adjustments on a monthly basis or a 6-week basis or whatever, and you fall into that trap. And meanwhile, they may have gone from 40 to 60, and suddenly they've got different risk factors for both falls and fractures and muscle mass and bone density. And unless we pivot to actually assess that associated with their age, then we just keep on doing the same thing. And that's something which I've had to really focus on, because we do get comfortable in our practice, and we need to modify our practice according to their risk factors.
Yeah, couldn't agree more. And so, I highly encourage those long practicing and serving chiropractors to start looking at this in a little bit more detail. And it also adds a bit more variety to the office as well, doing something new again.
Yeah, exactly.
And I'm sure the patients, like I said earlier, would really appreciate that. Now, I want to come back to, in terms of you being, as I mentioned at the start, the ACA's ACE Lifestyle Medicine chair. With you being in the chair and of this, the ACE Lifestyle Medicine group, how do you see the group contributing towards supporting those afflicted with, namely osteosarcopenia and sarcopenia in general? How do you feel, and how do you see the actual lifestyle medicine group contributing towards that?
Okay, so specifically regarding our group, Lifestyle Medicine, we're probably more in the kind of realm of healthy aging, not only older age, but people as adults. Lifestyle behaviors become really important because lifestyle behaviors in pediatrics or kids and adolescents is largely determined by the families.
Yeah.
But when it comes to adults, unless to go back a step, every one of our clients presents with usually some kind of musculoskeletal condition or some presentation that they want kind of seen to. Mm-hmm. But each one of those clients as well presents with a lifestyle that we're blind to unless we actually assess that. Mm-hmm. So there are three things that our ACE lifestyle group wants to focus on. Firstly, we would encourage all chiropractors to know how to screen for lifestyle determinants of health, that being nutrition, physical activity, mental health, sleep, social connections, and alcohol and tobacco. Mm-hmm. And as I said before, we don't necessarily want to be managing all those conditions, because some people will feel more comfortable doing that. Other people will feel like they want to refer out to specialists in that area. Mm-hmm. But at least we should be screening for lifestyle determinants of health. And so our group wants to educate all chiropractors practicing on how to actually simply screen for lifestyle behaviors.
Yeah. Okay.
So that's the first thing. And if chiropractors would like to join the ACE Lifestyle Medicine CPG, then that's a really good place to start. Mm-hmm. Secondly, regarding sarcopenia and osteosarcopenia, we want to educate chiropractors on how to actually do that. to assess and manage sarcopenia and osteosarcopenia, very much in our scope of practice. And so we'll be showcasing this at the ACA National Conference in Adelaide, called the Big Tent, in August. So we'll all be there, and hopefully we get a big roll up to the Big Tent in August.
Yeah.
And following the Big Tent or the ACA conference in Adelaide, we'll be rolling out our sarcopenia education program for early detection, and there'll be a standalone kind of course offered each year for that. And thirdly, because of the importance of this and co-management with other professionals, we want to reach out to patients who know nothing about this, to our professional colleagues who also know nothing about this, and other health providers to educate them on the importance of early detection for sarcopenia, osteosarcopenia, and the health ramifications that can come from that. Because unless we've got the awareness, then we're not going to be doing anything about it.
Yeah, good point. Oh man, I'm so looking forward to the Big Tent. It's the first time I think all of our ACE groups will be under the one seminar, so presenting at the same time over the course of the weekend. So I'm so looking forward to that, and I definitely will be catching up with you at that one, Peter.
Love to. And looking at the chiropractic scope of practice, the PEDS group, of course,
yes,
experts in the assessment and management of pediatric conditions. The sports group, such a popular group because sport is so important for Australians and for chiropractors. Neuro rehab group, neural function is so important for chiropractic paradigm, and then the lifestyle factors that we can bring to the table. It's going to be a really fantastic conference, and I'd encourage everybody who's able to get to Adelaide in August.
Couldn't agree more. And absolutely, for those who are listening, I know that I'm always harping on it. The Big Tent, remember that. It's so important that all chiropractors, and it's a great way for us to all come together and catch up. There's such a strong collegiate feel when you get the whole profession under the one tent, I guess, all catching up, and there's so much that happens between the seminars and the presentations too, where we get to catch up, and sometimes people you haven't seen for almost 10, 15, 20 years. It's a great way to catch up. It's a great way to spend the weekend, and obviously we'll learn so much from the weekend as well. So I can't agree more about everybody needing to come down to the Big Tent this year.
Really looking forward to it.
Likewise. Well, Peter, that's been fantastic. That brings us to the end of today's conversation. A big thank you to Dr. Peter McGlynn for shedding light on the complex but incredibly important relationship between sarcopenia and osteosarcopenia. As we've heard, muscle and bone health are deeply intertwined, and recognizing these conditions early, like Peter was saying, whether you're a clinician, a carer, or just a community member, can make a profound difference in the quality of life, independence, and the long-term well-being of the general public. So, it's so important. I can't overemphasize that again. Guys, if you found today's episode valuable, make sure to share it with your colleagues, the students, and anyone interested in supporting healthier aging in their practice or community. And as always, thank you for tuning in to the ACA National Podcast. I'm Dr. Kim Lie Jom. Until next time, stay well, stay curious, keep advocating for better musculoskeletal health for all Australians. Peter, I can't thank you enough for your expertise. Thank you so much for your time, and I look forward to catching up with you in September.
Thank you so much, Kim, and I look forward to seeing you too in August.
Thank you.
All the
Take
best.
care. Take care.
Bye.
All the best.